frequently experience fever or high body temperature. We as physicians define fever as a body temperature of more than 38 degrees Celsius or 100 degrees Fahrenheit. Moving on, let's talk about what other signs should you look for in a child who is having fever, and when should you seek medical advice or visit a doctor. Have your child hold it in place with their lips and not their teeth, and tell them to breathe through their nose. Hello and welcome to my channel where I provide key information about children's health. Today I will discuss a really important topic: understanding and managing fever in children. Children frequently experience fever or high body temperature. We as physicians define fever as a body temperature of more than 38 degrees Celsius or 100 degrees Fahrenheit. Fever is the body's normal response to many illnesses, the most common illness being an infection. In most cases, a fever is actually beneficial, as it boosts the immune system's ability to fight off that infection. Now, most parents like me get worried about their children's health when their child have a fever. But as doctors, we mainly focus on what is causing the fever rather than the temperature itself. I always tell to parents that it is more important for them to monitor any symptoms of the underlying illness, which we will go into more detail in the video, and not only focus on the temperature. So let's first talk about when to take your child's temperature. Well, I always advise parents, you can take your child's temperature at any time. But in certain situations, it is a good idea to take a temperature of your child if you feel the child looks unwell and feels warmer than usual. The child may look irritable or is crying, looks more sleepy than usual, is in pain, is refusing to drink, or is vomiting. Now, if you're in doubt, measure the temperature and document it, so you can create a trend over the day and see if it is getting better or worse. And when you visit your doctor, we usually grade fever as high grade or low grade based on numbers. So that temperature measurement helps us in managing your child. Next, let's move on how to take your child's temperature and what's the best place to do it. My advice to you is it's best to check your child's temperature using a thermometer. Feeling your child's skin temperature by putting your hand to their forehead is not a reliable way of diagnosing fever. Most modern thermometers are digital thermometers. We call them digital probe thermometers. You can use a digital probe thermometer to take your child's temperature in two main ways. Number one, orally or through the mouth. Now you put the thermometer in your child's mouth under the tongue. The best way to take an oral temperature using a probe thermometer is to place the thermometer well under one side of your child's tongue. Have your child hold it in place with their lips and not their teeth, and tell them to breathe through their nose. Wait until the thermometer beeps and then check the digital display for the temperature reading. If your child has had a hot or cold ring, I recommend wait 5 minutes before taking their temperature. A practical tip is that you can take oral temperatures in children over 4 years. It can be sometimes difficult to take oral temperatures in children younger than this, because they might not always cooperate with you. Now, if your child has a blocked nose because of a cold, then they may find it hard to breathe with their mouth closed. In this case, the best thing to do is to take your child's temperature under the armpit or in any other way. Now let's look at the second way to take or measure temperature. It's called the axillary or under the armpit. You put the thermometer under your child's armpit. Now the best way to take an armpit temperature using a probe thermometer is to place the thermometer in your child's armpit, making sure it touches the skin and not the clothing. Close your child's arm over the thermometer, holding their elbow against their body. Wait until the thermometer beeps and then check the digital display for the temperature reading. Taking your child's temperature under the armpit is usually the easiest way to do it, especially in young children. Unfortunately, it is less accurate than an oral temperature reading. But anyway, it works and it gives you an idea as well. A practical advice for all of you is, if you plan to check your child's temperature orally and under their armpit using the same thermometer, make sure you clean it well between each use. You can clean a thermometer using warm soapy water or alcohol wipe. Do not use a digital probe thermometer to take a rectal temperature reading. First of all, it's uncomfortable for your child, and secondly, there is a risk that the tip of the thermometer could damage the lining of your child's rectum. Next is your digital ear thermometers. Now, digital ear thermometers are specially designed for use in children's ears. Ear thermometers are quick, easy to use, but they can sometimes be a little bit inaccurate. The best way to take an ear temperature using an ear thermometer is to put a plastic cover over the tip of the thermometer and then put the tip gently just inside your child's ear canal. Wait until the thermometer beeps and then check the digital display for the temperature reading. Now, the readings from the digital ear thermometer can be affected by small ear canals and something like ear wax. These readings can be a little inaccurate as compared to oral thermometers or oral temperature readings. Then you have the most common way to do it is digital forehead or temporal artery thermometers. And you place the digital temporal artery thermometers on your child's forehead to measure the temperature. The best way to take a forehead temperature using a temporal artery thermometer is check that your child's forehead is dry before starting. Gently scan the thermometer across your child's forehead and then remove the thermometer and then check the digital display for the temperature reading. Now, these are the easiest types of thermometers to use, but remember, they can sometimes be inaccurate. So always look for other signs and symptoms as well, which I will discuss in the video. It's better to use a different type of thermometer if you have one. Other kinds of modern thermometers that are available are digital pacifier thermometers, fever strips, and smartphone apps. Now, I personally do not recommend them because they can be inaccurate. Remember, you should not use old mercury thermometers because mercury thermometers can poison a child if they break. If you're using a mercury thermometer, consider replacing it with one of these types of the digital thermometers that we discussed before. Moving on, let's talk about what other signs should you look for in a child who is having fever, and when should you seek medical advice or visit a doctor. Firstly, it's normal for your child's temperature to go up and down if they are unwell. The most important thing is to watch your child for signs of serious illness and seek medical attention immediately. You should get worried if your child is having any of these symptoms. For example, looks sicker than before, your child is more pale, lethargic and weak, has trouble breathing, is drowsy, child seems mildly dehydrated or dry, child is refusing to drink or is peeing less than often, if your child has a stiff neck or a headache, or when they look at light it hurts their eyes, the child is vomiting or has diarrhea, the child is constantly irritable or uncomfortable, you see that the child has developed a rash, the child looks more sleepy than usual, then you should seek medical advice immediately. If your child is in the first year of his life and has fever, visit your doctor or pediatrician as soon as possible. If your child is over a year and has fever, then you can provide care at home if you feel comfortable and are actively looking out for those worrying signs as mentioned previously. Always remember, seek help and advice early. As pediatricians, we are here to support you and your child. This brings us to the last part of the video today, where I would like to share with you from my personal experience being a father how to take care of your child with fever at home. Now, the most common cause of fever in children are infections and can be caused by different sorts of germs. Most are caused by viruses and don't need any treatment. A few of them are caused by bacteria, which are treated with antibiotics. Remember, antibiotics do not work on viruses. One tip that I can share with you is that lowering your child's fever will not help treat the underlying illness. More quickly, if your child seems well and is happy, there is no need to treat a fever. If your child is feeling miserable, there are things you can do to help them to feel more comfortable, and I have personally used these techniques for years, and they have really helped my kids feel better when they get sick. First thing, you should give your child frequent small amount of drinks. Many children will refuse to eat when they have fever. Although this is not a huge problem, as long as they stay hydrated, they will be fine. If your child is breastfed or is younger than 6 months, you should offer extra breastfeed. And this helps them because they get antibodies from their mom to fight the infection. If your child is formula fed and is younger than 6 months, you don't need to offer them extra. You can offer them the usual amount of formula milk. If your baby is older than 6 months, keep breastfeeding or bottle feeding. You can also offer your child water or oral rehydration solution. So the idea here is always give your child smaller amount of fluids but more often. You can give your child paracetamol or ibuprofen. If the fever is making them feel miserable or they have other symptoms such as sore throat or runny nose. Now, don't assume and carefully follow the dosage instructions on the packaging. This is very, very important. Do not give ibuprofen to babies under 6 months old or to any child who is dehydrated. Never give aspirin to children. Try wiping your child's forehead with a sponge or face washer soaked in slightly warm water. Temperature between 27 to 32 degrees is good, and it will help them feel comfortable. It is important that they don't become too cold or uncomfortable when you do this. Cold baths or showers are not recommended because by chilling the skin and inducing shivering, cold water can actually raise the core body temperature because of shivering. Dress your child in enough clothing so that they are not too hot or cold. If your child is shivering, add another layer of clothing or blanket until they stop shivering. Thank you for watching, and remember, always watch your child for worrying signs and take your child to the doctor if they seem to be getting worse or have prolonged fever. Now, I'd love to hear from you, so leave a comment with your experiences and questions. If you found this video helpful, make sure to hit the subscribe button and the notification bell, and stay informed for more valuable content. You can connect with me on my social media to stay updated and engage with our community. You can also visit my website drowasrafiq.com to get expert guidance that you need to keep your little one healthy and happy. Pain is common in many injuries and illnesses in children. Before we talk about these two most commonly used pain medications,